Hello, everyone. We'll get started in a couple of minutes right at the top of the hour. Hello, if you're just joining us, we'll get started in about a minute right at the top of the hour. Hello, and good morning or good afternoon, depending where you are. Welcome to our webinar today. Today's webinar is Regional Planning and Health, how MPOs are using regional transportation planning to advance health. My name is Michelle Lieberman. I'm the Senior Technical Assistance Manager at the Safe Routes Partnership, and I'll be facilitating today's webinar. Today, we're going to hear about the role of MPOs in supporting healthy communities. We have speakers from two MPOs who are going to share how their agencies have used their regional transportation plans and other responsibilities as an MPO to advance health in their respective regions. With that, let's go ahead and get started. A little bit about the Safe Routes Partnership. If you're not familiar with us, we're a national nonprofit organization working to advance safe walking and biking to and from schools, working to improve the health and well-being of kids of all races, income levels, and abilities, and fostering the creation of healthy communities for everyone. How do we do this? We work to improve the quality of life for kids, families, and communities. We're advancing policy change at the federal, state, regional, and local levels. We catalyze support for safe, healthy, active communities. And we share our deep expertise as we learn from the field. So a little bit of webinar housekeeping. On the left is the GoToWebinar viewer through which you'll see the presentation. And on the right is the GoToWebinar control panel. Here you can raise your hand, ask questions, and select the audio mode you use. Please note your control panel will collapse automatically when not in use. To keep it open, you can click the View menu and uncheck Auto Hide Control Panel. There are two options for listening to us today, telephone or your computer, mic, and speakers. If you have a sound problem with one selection, try the other option. We'll do our best to field any issues if you just send us a chat message. Even though you're muted today, we want to hear your input and get your questions. Use the questions box to ask speakers questions, and we'll try to hold a bit of time at the end for Q&A. And we'll try to answer your question if there's time at the end. So after today's presentation, if you want to view it again or send the link to your colleagues or friends, you can do this by going to our website, saferoutespartnership.org. If you click on the resource tab and click on webinars in the list on the left side of the page, all of our past webinars are stored here for your viewing pleasure, and the recording for today will be up shortly. So in addition to this webinar, we have just released two new publications on MPOs and health. You can find these on our website. The first one is on MPOs and health and 101 and covers the nuts and bolts of regional transportation agencies. And the second one, MPOs and Health 201, covers best practices and promising opportunities for MPOs to support health. Now for our speakers, we have a great lineup today, and I'll share their full bios before their presentations, but want to just give you a quick run through of our agenda. Sarah Zimmerman will give us a brief introduction to MPOs, and then Wade Reynolds and Michelle Ogilvie from the Plan Hillsborough in Florida will share their great work that's happening in their region to support health. And then Grace Cho from Metro in Portland, Oregon will share their work on supporting health and equity. So we'll start with Sarah. Sarah is the Program and Policy Director for the Safe Routes Partnership. In this role, she works to support communities in obtaining resources and advice they need to increase physical activity and safe walking and biking for children and adults. She oversees the program and policy team in providing high-quality assistance and advice to low-income communities and other communities of different sizes in different regions across the country.
Hello, everybody. Let me just get things set up here. Do I need to switch the views?
Yes.
All right. Hey, everyone. I am Sarah Zimmerman, as Michelle said. I'm the Program and Policy Director at Safe Routes Partnership, and I am super happy to be providing this brief introduction to Metropolitan Planning Organizations, also known as MPOs. We're going to talk about what they are and why they matter for health, for active transportation, and for safe routes to school. I think that MPOs are probably one of the most important and yet most poorly known and understood agencies out there. So we're really hoping that this webinar and its companion webinar that we have coming up next week are going to really help clarify what MPOs are, why they matter, what great things many MPOs are doing, and how public health and active transportation advocates can work better with MPOs to make sure that our regions are developing into the healthy, vibrant, walkable, sustainable places that we really want them to be. So let's just quickly review what a Metropolitan Planning Organization is. MPOs are the regional planning agencies for metropolitan cities, for their surrounding urbanized areas, the suburbs, smaller towns that are right nearby, and then also for the contiguous areas that are expected to become urbanized in the next 20 years. So they cover that whole area in their region. They're mandated by federal law, they're established by state government, and then they're operated by local decision makers. So just right from the very way that they're structured, they inherently involve this kind of complex mix of stakeholders. They're required for any urbanized area that has a population of over 50,000 people. So an MPO's area can be smaller than a county, or it can encompass many counties. There's over 400 MPOs across the United States, and every MPO plays a really essential role in planning for its region's future and in making determinations about how transportation funds are invested to achieve those plans. So how do MPOs work? Every MPO is governed by a policy board, which kind of is the MPO itself. The policy board is generally composed of elected and appointed officials from the cities, towns, counties, within the boundaries of the MPO, and often also include public transportation providers in the region, and can also include a variety of other stakeholders too. Policy boards for MPOs around the country have very different structures in membership and voting allocations, and that ends up having a really big impact on the decisions they make, the investments they make, and the overall direction that they kind of embrace. The goal of the MPO, and the reason why all of these different parties are brought in, is that the goal is to coordinate planning among all these actors across the region. MPOs almost always have technical advisory committees, which are made up of transportation engineers and planners from local jurisdictions, and they often have a variety of other advisory committees as well. So that may be bicycle and pedestrian advisory committees, which many of us are probably familiar with, citizen advisory committees, and a range of others. Let's talk a little bit about why MPOs matter so much. More than 70% of people in the United States live within the areas that are in the jurisdiction of MPOs, even though that land area within the MPO boundaries only makes up 5% of U.S. land area. So what that means is that MPOs are guiding decisions that end up affecting the majority of our population, and also are working in these areas that are really our economic powerhouses. So their decisions are really important. As we've already alluded to a little bit, MPO planning and actions really have a big effect on how transportation and also land use decisions are sort of playing out within their regions. And those decisions have a really, really deep and significant effects on health. So MPO decisions end up having a strong influence on things like our ability to get physical activity by walking and biking to everyday destinations, which really affects our likelihood of developing chronic diseases. Our likelihood of death or serious injuries due to traffic collisions. We know that this affects, close to 40,000 people per year who die, and even more who are seriously injured. Things like the chances that our kids develop asthma, that we get lung cancer, that we experience miscarriages, the effects of how much climate change ends up affecting how much transportation ends up contributing to climate change, this sort of wide array of issues that are really important to our health and our well-being. So let's just talk a little bit more concretely about how MPOs carry out their duties and what they really do. So the core duty of MPOs is to engage in short and long-term planning that in large part controls which substantial transportation projects in a region do and do not move forward, and how federal and state transportation funding gets spent in that region. So MPOs do this by engaging in what is more or less continuous long-term planning. So they develop documents known as long-range transportation plans, and those documents may also be known as regional transportation plans that go by different names in different areas. And those set out goals, objectives, and projects that are aimed at achieving those goals. MPOs are also developing short-term lists. So they're doing short-term planning and developing lists that are known as transportation improvement programs, TIPs. And in those, they are selecting the projects that are going to be funded in the next 4 years. But to get into that project list, to be selected in the TIP, the project has to be in or consistent with that long-range plan. So basically, all of this planning ends up being essential, not just because it is very important to step back and think about how we want to guide these very important decisions and what we want the future to look like in our communities, but also very concretely and immediately, it's determining what actually gets built in our communities. But beyond that core duty, MPOs are also doing so much more. They're involved in so many more things. Some of these things are required by federal or state law. Others of these things are voluntary activities that are selected to advance goals that the MPO has focused on, such as health, physical activity, economic opportunity, things like that. So examples include MPOs award funding that's under their control. They engage in congestion management planning and actions. They conduct required public engagement. They do a lot of that. Provide technical assistance, trainings, and model policies to help guide local jurisdictions and help kind of steer some of the decision-making happening with those local jurisdictions. They coordinate stakeholders, and they do many, many more things as well. So with that really lightning overview of MPOs, we're now going to turn to our friends at some MPOs, as Michelle mentioned before, to hear about really a variety of the amazing different things that they are doing.
Thanks, Sarah, for that great overview. So next, we're going to hear from Wade Reynolds and Michelle Ogovive from Plan Hillsborough. Wade is the senior planner at the Hillsborough Metropolitan Planning Organization, which is the transportation division of Plan Hillsborough. He's a graduate of SWANY, the University of the South, with a bachelor's in environmental policy, and the University of Florida with a master's in urban regional planning. Wade is the staff coordinator for the MPO's Bicycle and Pedestrian Advisory Committee and works on a variety of bicycle and pedestrian facilities and health collaborations in the city of Tampa, Plant City, Temple Terrace, and unincorporated Hillsborough County. Michelle Ogovive is an executive planner for the Hillsborough MPO with 30 years of community, land use, and transportation planning experience. In her tenure, she has worked on award-winning projects such as the Tampa Heights Neighborhood Plan and written publications in the Practicing Anthropology Journal addressing the impacts of welfare reform on affordable housing and low-income households. She holds a bachelor's in anthropology from Eckerd College and a master's in applied anthropology from the University of South Florida. Take it away, Wade and Michelle.
Hello, everyone, and thank you so much for spending some time with us this afternoon so we can tell our story. We just got a whirlwind tour of what MPOs are, and we would like to take a little time to talk about how we have engaged community with community involvement, coordination, and cooperation, the guiding principles of MPOs. When it comes to health, we have been working for some time with our local health department, and they have been teaching us about health. What shapes our health is outlined in this title, in the screen, but 50% of it belongs to us, the people who work in the public sector, who do policy. And so we're kind of important in terms of sharing the responsibility of good health outcomes. We affect health through safety, our active transportation, air quality, connections to our destinations, and equity. How we ensure our aging parents, grandparents, children, persons with disabilities, and low-income families to access the choices that they need to allow them to live long and healthy lives. What is Health in All Policies? It's a program that is collaborative, and there's a movement that's taking place nationally. The slide you see now is from the 2017 program that we have been involved in. Some of our MPO board members have been engaged in this process. And you can see that the whole system, all our land use, our transportation, energy, the economic development, infrastructure, parks and recreation are all important in how we express our health, human health. In our world, we consider health through our Complete Streets program. We have a Vision Zero goal. Our Health Atlas is a program that we'll talk a little bit more about, and our Long Range Transportation Plan update. Access to education, jobs, services, and healthy foods are all part of how we promote better health outcomes in Hillsborough County. The ingredients of our Health in All Policies approach include active transportation, aging and disability, physical ability and activity, and again, access to the things that many of us take for granted. Access to a job, to our school, healthcare, healthy food, and of course, recreation.
And so looking at how planning projects can improve health, there are a number of ways, intersections between planning and health. First, injury and mortality rates of drivers, pedestrians, and bicyclists. We happen to have one of the highest in the country here, which we're doing a lot, well, what we can to try and bring down, particularly with our Vision Zero campaign. Physical activity rates through biking, transit, and walking to public transit and other locations. This can help prevent and mitigate obesity and chronic disease and help maintain people's health through that. And then focusing on air quality and greenhouse emissions, we can hope to reduce asthma exacerbations and other negative health outcomes from that. Finally, access to goods, services, and resources such as healthcare, healthy food, job opportunities, and education can all help to improve health in the community. We say that we measure what we value. Right now, some of the common things that MPOs measure, annual average daily traffic on a road segment, the number of lane miles that we have, average travel time and speed, average delay for vehicles, and the traffic volume and volume to capacity ratio, and levels of service. These usually help prioritize how projects move forward in the planning process, both through the Long Range Transportation Plan and the Transportation Improvement Program, which is the shorter time frame 5-year plan. So just to give an example of a project that moved a little bit higher in the rankings based on that, the George Road Complete Streets study was designed to link 2 major regional trail systems. I apologize, the red circle has moved away from where the actual trail is, but it still works for the point of this conversation. So this project was going to connect 2 major trail systems. We were going to look at paved shoulders with bike lane markings, narrow the traffic lanes, installed shared lane markings on a portion of it, repave, fill in the sidewalk gaps, add wayfinding, work the traffic calming measures to help bicyclists and pedestrians or prioritize them, install lighting and ADA compliant facilities as well as crossings. So when we think about that project, it was basically the first project we had worked on with the health department. And the neighborhood has a good deal of evidence of poor health outcomes. So connecting these two trail systems was going to provide access for the community that it went through, as well as connecting the trail systems into a much larger system. Excuse me for repeating that again. So looking at how we might then measure some things differently than our standard measurements, we look at level of service and quality of service to some extent, but a project that we just wrapped up is looking at level of traffic stress for our bicycle and pedestrian facilities. This is a map of Hillsborough County on the right. You can see that there's a lot of red in it, but as we have been putting in trail facilities, separated bike lanes, and just looking at the appropriate facility for the road type, the volume and speed of traffic, you can see that particularly in the inset below the map, you can see all the green and light green and yellow start to show up. And those are the level of traffic stress 1 and 2, which is what we're really trying to get to, which is a low enough traffic stress for most people, including young people and older people, to handle. So another tool that we have created and just recently updated over the summer is the Hillsborough County Health Atlas. We look at the interconnectivity of health, the environment, transportation, the food environment, and emergency preparedness and response. Looking at inequity, this is in many of our food desert areas also face high rates of diabetes, obesity, asthma, little leisure time, and poor physical and mental health outcomes. Looking at those indicators in the beginning, this is asthma on the right, for example. That dark blue area is an area of low sidewalk connectivity, high asthma prevalence, but also high diabetes and obesity prevalence, even though it's a food desert, because of the lack of access to high quality foods. Just looking at environmental inequality, this is also from the Health Atlas, but this is the EPA's EJ Screen tool, which shows the National Air Toxics Assessment Respiratory Hazard Index. And those largely follow our major roadways and major industrial areas. So they also have some measurements of diesel particulate matter, which is typically a measure of roadway proximity, and Superfund site proximity. Also, transportation inequity here. We have looked at our food deserts, and there's also low sidewalk coverage within them, high numbers of severe vehicle crashes, making it dangerous to walk to or from transit or to a grocery store, and low non-motorized access to sources of fresh produce. So being able to evaluate and quantify the benefits of a project that would provide more access to those sources of fresh food would be a major benefit to some of our food desert areas.
And now we're going to tell you how we've been working with community partners. We were lucky enough to accept the challenge from the Healthier Cities and Counties Challenge, which was an Aetna Foundation funded program with the American Public Health Association and the National Association of Counties. Our community partners, such as the Coalition of Community Gardens here in Tampa Bay, had asked us to apply and help them promote the growth of community gardens. I'm sure that there are many communities in your region that have access to food, food banks, as prevalent as we do here. It's just a fact. And so one of the things to respond to food deserts is the idea of promoting community gardens. We used our partnership with the City of Tampa's Transportation Department, the City of Tampa's Economic Development Department, and of course the Florida Health Department. And would like to summarize our story, which was 3 years in the making. Food is extremely important, of course, because if you can't eat, you're not able to work or feel good. And so when we started this project with our land use part of our Plan Hillsborough group, we mapped out the areas where there were food deserts and then matched where our community gardens were. Using the information that Wade has just shown you all from our health atlas, we decided that it was time to do some work in demonstrating how we could make that change. One of the things we did was use our community garden in the Tampa Heights neighborhood, which is just north of downtown Tampa, and we sponsored a Grow Gardens, I guess we could call it a convention. It was 150 people showed up, and we sat and talked about all things that bring healthy food. We were supported by many of the local gardens, and we brought in some of our legislators and local, what would we call that gentleman on the right? He's a radio and television personality, and they all showed up and engaged. Some of the opportunities that we have been able to harvest is the City of Tampa provided for the first time pedestrian signage showing there's a garden within a mile and how long it would take to ride or bike, or I should say walk and bike. And Wade and I are talking about the fact that we missed out on the in-betweens. A mile is a mile, and sometimes you can get lost in an urban area. We also sponsored the children of the Tampa Heights Garden, showing how they are harvesting herbs and then turning them over to local restaurants, farm to table or garden to table in this regard. And we have been engaging with other neighborhoods, seeing if we could get some support to create gardens in the places where there is high incidence of diabetes and asthma and other chronic diseases. What's next for us is that when we did decide on a location, we found that we got great support in a pop-up garden that we did last year along one of our corridors. We are now exploring a way of creating a healthy street theme where the garden will become part of the story on how you can grow something in season. And then with some cooking demonstrations, we can get people thinking about changing the way they eat. We're looking at the federal government's health centers that are here as part of our new partnership, as well as perhaps even the police department, who has great land that they might be able to give us for a community garden. And that's what we're hoping to do and are planning to do in creating a healthy community. Thank you all very much.
And with
Michelle and Wade. Thank you for sharing with us what's going on in your region. Great, it's wonderful. Next, we're going to hear from Grace Cho. She is a transportation planner at Metro, the Metropolitan Planning Organization for the Portland, Oregon region. Her work focuses on the implementation of regional transportation plans and policies. As part of her work, she conducts equity analysis and environmental impacts of transportation plans and funding programs. She received a master's in urban and regional planning from the University of Washington in land use and transportation planning, and a bachelor's degree from Bowdoin College in history and environmental studies.
All right. Hello, everyone. Thanks for attending the webinar today. I'm honored to be one of your presenters. Today I'm going to talk a little bit about Metro's recently adopted regional transportation plan and how our plan approached embedding equity into the long-range blueprint and the planning process. So just briefly, since I know folks are from all over the country, some context about the Portland, Oregon metropolitan region. We're made up of 23 cities and 3 counties. We're just under nearly 1.6 million people, and that's primarily on the Oregon side. And we have about a little under 900,000 jobs. The region's a bit unique, and what we're often known for in terms of a transportation and urban planning context is one, being a bi-state MPO, meaning that we jointly have we are a joint MPO. I shouldn't say joint. We have some shared MPO responsibilities with our neighbors to the north in Washington, the Southwest region. Also, what's kind of unique about the Portland region is that we have a directly elected government. We're the only one in the whole United States. So we have a Metro Council combined with our MPO policy board that really governs the decision making for our transportation functions in this region. We're also in Oregon, we have a statewide land use planning law, and that's also led to growth management, which for our region has really translated into this long-term 2040 growth concept. So it's really trying to link where are we planning for future population and employment growth, and how are we linking our transportation investments to link those different places together. And then last but not least, we're also known for quite a unique regional identity, often reinforced by a well-known television series. So our regional transportation plan, which was adopted in December of 2018, as I mentioned, our region's leadership adopted a transportation plan that encompassed a $42 billion investment strategy that would take place over the next 22 years. This investment strategy comprises of a little over $15 billion of capital investments to complete gaps in sidewalks and the bike network, build out the high-capacity transit system, upgrade arterial streets to complete streets, and some strategic roadway expansions. The remaining $27 billion is really for that maintenance and operations side. Really, it's about fixing pavement, upgrading those traffic signals, replacing buses, et cetera. So 4 main policy priorities really shaped the final plan, essentially, and a number of its implementation actions, and had actually a huge impact on what the investment profile ended up looking like. And these 4 policies were transportation equity, where we're addressing the transportation needs of our historically marginalized communities, while also being intentional about reducing and eliminating disparities experienced around transportation access, safety, and affordability. Transportation safety, which I kind of briefly mentioned in the context of transportation equity, but in our region, we're aiming to get to 0 traffic related deaths and life-changing injuries in the greater Portland region by 2035 through a collection of engineering and design interventions, behavior change, enforcement, and other strategies. The third, and I shouldn't say that these policy priorities are not ranked, I'm just kind of walking through them. The third is about addressing climate change, and so we have, as part of a state law that was passed in 2009 or 2010, but our region developed and adopted a climate smart strategy, which really looks at the linkage between land use and transportation and reducing our greenhouse gas emissions from light duty vehicles by 29% per capita by 2035. And then lastly, managing congestion is the fourth priority to emerge out of this plan, and that's really about utilizing um, the existing system more efficiently and looking at other policy tools such as roadway pricing, as well as considering expansion of the roadway system when it's most strategic. So I will say that getting to these four priorities for our plan wasn't always easy. There was a lot of competing priorities being discussed in the process of our plan development. But I will say that these four that I'm raising right now, and particularly transportation equity and safety, um, community voices played and being at the table, really reiterating the why and why now, kept those as a huge focus of the plan. So I just want to backcast a little bit because for us to really adopt the plan that we did in 2018 with its core focus around equity, safety, addressing climate change, and managing traffic congestion on our system, there was a few pivotal moments that really in the preceding years that kind of led up to that kind of built up to the development of our 2018 RTP. So the first one I just want to talk about is that there was the 2014 Regional Transportation Plan, and I believe in Sarah's presentation she mentioned our long-range transportation plan actually has to be updated on in most cases, 4-year cycle, but sometimes it can be a 5-year cycle. And so the 2014 RTP was the immediate preceding plan, and pictured right, this was what the first plan where Metro conducted its first equity evaluation to see whether our investment program was investing equitably in our historically marginalized communities. This evaluation, as I said, was the first for Metro. It received a lot of critical feedback during the public comment process, and that analysis and the approach to how we did that evaluation, like the feedback that we had around the approach to that evaluation really shaped and teed us off to a different approach that we took in 2018. And so actually as part of our recommendation in 2014 is that we made a commitment with the adoption of that plan to reapproach the evaluation in 2018 pretty differently. And we wanted to make sure that we were reflecting the community values as part of the 2018 RTP update. So another real pivotal moment in terms of the development of the 2018 RTP landing on those four main priorities was early on in the scoping process of the development of the 2018 plan. Starting around late 2015, our leadership, the Metro Council and staff, went on a listening tour asking community leaders, elected officials, business leaders, and putting out a survey to the public what should be the focus of the plan. And what you're seeing is the main kind of topics that rose to the top through that scoping process. And what I highlighted in red points out that there clearly like equity started to come up early on in that scoping, but there was also a lot of crossover topics that were where kind of equity meets health and a number of considerations that we embedded into the equity analysis as part of the plan. So lastly, probably the third pivotal action that occurred, and that was actually happening in parallel to the development of our 2018 Regional Transportation Plan, was the adoption of Metro's strategic plan to advance racial equity, diversity, and inclusion, and that happened in the middle of 2016. This RTP was the first RTP influenced by the strategic plan, and it provided a really strong policy backing for staff to pursue this focus on embedding the voices of historically marginalized communities into the process, as well as influencing the plan outcomes. So how did equity play out in the context of the RTP? Well, first, it really did shape greatly how we approached our public engagement strategy. So to start, I just wanted to talk briefly about the approach of the engagement strategy. At the outset, our technical and communication staff came together to define some principle to guide how we wanted to handle the public involvement and how that should look for this plan. Also knowing that both our elected officials, community leaders, and members of the public expressed a desire to understand and address transportation disparities, our public engagement approach needed to make sure we're bringing the unheard voices to the table. So this is what you're seeing is the list of where we landed in terms of our engagement principles, which again just reinforced a lot of the different engagement strategies that we used as part of the plan. So I don't mean to be a spoiler, but over a 3-year process, and in following those engagement principles, we were able to get a lot of feedback, and we had nearly 19,000 individual touch points over those 3 years through a variety of different means. I'm just going to highlight 2 out of the 6 of the kind of major engagement strategies that we utilize throughout our plan development, and that's the regional leadership forums as well as the community leader forums. So the regional leadership forums, this is where we brought together our elected leadership, heads of transportation agencies, business owners, and community leaders at 4 key milestones of the plan development. And the regional leadership forums were where we sought direction of our region's leaders to shape the final vision, policies, and investment strategy of the plan. I can say the role of community voice at the final leadership forum, which you can see at the top photo up there, was incredibly influential in that their presence and voice at this meeting really convinced our regional leaders to direct staff to revise our investment strategy to do more to address disparities still being observed in safety and access for our historically marginalized communities. Our community leaders forums, these were actually developed in response to some early feedback we heard back from our community leaders who participated as part of the regional leadership forums. And what we heard from our community leaders is that they felt they wanted to continue the dialogue that they were having at the regional leadership forum, but in a forum amongst other community leaders so they could actually speak a lot more freely, liberally about their thoughts in shaping the plan. So we held a couple of additional community-specific meetings through this plan process. And what that really did was it helped to further articulate what our communities wanted to see in the plan's policies and investment strategy moving forward. So aside from implementing a pretty progressive engagement process where we were bringing a lot of non-traditional voices to the table and elevating the experiences of our historically marginalized communities, the development of the plan itself and shaping that investment strategy, one of the key things we knew we were going to do at the outset is that we were going to undertake this technical evaluation to assess the outcomes of the plan's investments and understand how they addressed our historically marginalized communities' needs and values. So we did end up creating a technical advisory committee, as Sarah noted. Our advisory committee brought together, representatives from community-based organizations, transportation advocates, human services, public health, as well as our various jurisdictional partners, so other planners as well. And it was through this work group they really got to drive and define how we would evaluate our investment strategy that we were putting together for the long-range transportation plan. And what that means essentially is that they got to define and design what the evaluation measures were. Our starting principles for this technical advisory committee, we called it a work group, was was pretty simple in that one, we wanted to measure what matters most to historically marginalized communities and to let this evaluation help regional leadership understand how the RTP investments may or may not be reducing disparities and advancing equity. And then I just wanted to quickly also shout out that this work that we did as part of the advisory committee was thanks to a grant that we received from the National Institute for Transportation and Communities. And we actually partnered with the Hillsborough MPO, who was who was your first presenter. So it's always great when partnerships like that end up, we end up on the same presentations again, being able to talk about our work and work we continue to do. So so through that work group, what we ended up doing, based off of the feedback and engagement that we heard, the plan ended up really focusing and prioritizing 4 evaluation measures to see how the plan's investments would advance equitable outcomes. And these really centered around access, where we wanted to see how many more jobs and community places, such as like libraries, schools, hospitals, were accessible to the average historically marginalized household by transit, bike, and car. With safety, we wanted to see whether the investments on our region's high injury corridors, particularly the ones that are traveling through our historically marginalized communities, whether those investments were implementing various like safety countermeasures and other kind of elements that would address crashes, especially those crashes leading to fatalities and or serious injuries. With travel options, we wanted to see whether our investments were completing the region's active transportation network and whether there was a focus on that in our historically marginalized communities. And lastly, one of the key things that we heard was around affordability. All along the West Coast, you're hearing about quite the housing crisis and the growing strength of the economy of a number of the cities on the West Coast, where you're seeing a lot of income-related disparities. So what we wanted to look at is whether or not our plan, the investment strategy we're laying out the plan, would reduce the housing and transportation cost burden for the average household in a historically marginalized community. We didn't actually get to develop that modeling tool in time to deploy as part of this plan, so we didn't actually get to evaluate it, but I will say we did end up adopting some recommendations as part of our plan to continue forward developing that tool, and I'm proud to say we're actually going to pilot that tool as part of the analysis of our upcoming 4-year TIP. So it does, I guess my point is that a recommendation on a long range transportation plan does actually happen or does get does get implemented. So what did our transportation equity evaluation find for the 2018 RTP? Ultimately, what this $42 billion investment strategy over the next 20 years saw is that we'll be investing across the region and across modes. And in particular, what you'll also see is that there was a lot of focus of investment in our historically marginalized communities and addressing their needs and their and addressing a number of their desires of what they want to see from the system. And that was again really due to having that community voice at the table, helping to define the measures, helping to be at the table with our leadership and really discussing the trade-offs around the policies and the investments. Just furthermore, our region's historically marginalized communities, based on our analysis, will see further access to safety improvements that reduce the risk of fatalities and serious injuries, further build out of our active transportation network, and several more transportation options available. So ultimately, through this process, what have we learned in our plan's successes, not successes, and various challenges? Well, first, a few challenges we had to navigate. First and foremost, we really needed to get folks on the same page about what we meant when we were talking about equity. And while staff had the backing of our recent adopted agency policy, uh, not every partner was necessarily in agreement with that. And in the end, we had to acknowledge that some of us were all in different places, but we were very clear with um, our leadership was clear in saying this is how we are looking or how we're defining equity and how we're looking at it as part of the plan. So another challenge that we had to address, and I wouldn't say that we fully have grappled it all the way through, was really about being able to get and process data region-wide in a disaggregated manner that would tease out the disparities that are seen from the disparities our historically marginalized communities experience with our transportation system and how those future investments we were talking about as part of the plan's investment strategy would affect that disparities gap, essentially. Oops, sorry. Another challenge that we ran into is just, we had a 3+ year long process, and you know that that is a long time, and there's a bit of engagement fatigue that that happened along those lines. And then probably the other things to note, and I'd say like the last two bullets kind of comment are very much like aligned together, is that there was a bit of a challenge in trying to find that balance in developing a long range transportation plan that is intended to address a lot of like future orientated needs, but also thinking about the immediate impacts towards addressing like existing disparities and needs that our historically marginalized communities are feeling right now. So I will say one of the key things I guess that we learned out of all of this is that we were really fortunate to have bold leadership stake a lot of their political capital in this work. So just acknowledging the Metro counselors who are a part of that process. And then finally, just some lessons learned. Again, just having that policy backing and the elected leadership really having a desire to see this work get done was crucial. In terms of the long planning process, using a variety of engagement techniques was really key for us in that it helped to keep people engaged and allow them to kind of dip in and out of our process at times when they wanted to come into it. So um, other lessons that we learned as staff, just really being intentional. It took a lot of intentionality to just to do things differently and really approach a lot of the plan development differently. Probably another thing to note is just being okay with sitting in the passenger seat, or in a sense letting the reins be taken over by someone else. Um, I'd say that with the Transportation Equity Work Group, they're really driving and defining our evaluation measures. And as staff, we needed to figure out the way to work with that. So letting them take the driver's seat. And then lastly, I'd say I call this a ask and ask again. I say this in that the lesson learned here was that our stakeholders continued to ask difficult questions throughout the entire process and continue to ask for us to, whether it was to evaluate something in a different way, or in the case of like the community leadership forums, to have like another venue to be able to speak more liberally of what was on their mind. And I don't think at the outset we would have planned it that way, but it was that frequency of the ask that continued to come up, and that really again had us kind of pivot during the process, but yet at the same time it really made the plan a lot better. So if you're interested, website for our plan if you wanted to take a look.
Great. Thank you, Grace. It was great to hear about Metro's process and some of your challenges and lessons learned. We have a number of questions that have come in for our speakers, so I'll go ahead and I think we have time to get a couple of those answered, at least a couple of them answered. First question is for Wade and Michelle. Got a question from another MPO who's curious about how your planning process was identified and funded. Was it listed as a project in your Unified Planning Work Program? And did the process costs get paid by FHWA, FTA planning funds, or was there some other funding mechanism that helped you?
Well, I think to answer the first part of it, it all is in our Unified Planning Work Program. We're doing this largely through two sources, well, three: safety, non-motorized planning, and transportation disadvantage planning. And it is our planning funds from FHWA partially, and some in-kind funds just in terms of labor.
And state funds. And state funds.
Yep.
Great. Next question is for Grace. Could you talk about sources of data for the metrics and measures you discussed? The person asking those questions noting a problem that a lot of us have with data is having a limit or a lack of data being a limiting factor for measurability.
Sure. I'd say for a number of the measures, particularly like the access measure, the safety measures, I mean, we were using a lot of data sources that are pretty, I don't want to say like standard, but they're kind of the big sources you think about. We were using the decennial census, we were using the American Community Survey, we were using the high injury corridors was really informed by crash data that we received from our state DOT, as well as like other various features about the facilities. So whatever like information that we had about like functional blast speed and things like that. I think one of the biggest challenges for us was that our community, what we heard from the work group was that they wanted to see the data be further disaggregated. And probably the challenge there wasn't always necessarily disaggregating the data, it was having the completed coverage across the region. So if we wanted to disaggregate some of the demographic data and look at it relative to some of the active transportation network data, there was some spots where we maybe didn't have the complete picture of exactly what like the sidewalk gaps necessarily were in every single jurisdiction in our metropolitan region. So there were some challenges like that that we ran into at times, and they're continual challenges that we're trying to address now as we continue to work through implementing our strategic plan.
Thanks. I have another question here for any of our speakers to really answer. For someone coming from outside of an MPO who wants to learn more but is not sure about how to figure out what their MPO is doing about health or equity, do you have any recommended advice on where to look or sort of first steps?
I think Sarah should answer that. Go ahead.
Well, I'll take a stab at that. I think that one thing that would be a good place to start would be to attend a committee or board meeting and just try to talk to somebody in your own community MPO. But in our case, we have everything on our website, a ton of tools that are meant to help individuals find those things out, all of our publications, all of our ongoing projects. So, I mean, that's always a great place as well. And I'm sure Grace has some good ideas too.
I would say probably I'd reiterate like what Wade said, and then again, I think Sarah alluded to there's a number of various types of advisory committees that MPOs have. There's like typically there's a citizen advisory committee. I mean, I know our agency has an agency-wide public engagement advisory committee. We happen to have advisory committee specific to our racial equity plan. So, I mean, I think there's kind of a number of those kind of formal ways to connect in. Probably more informally, it's just uh, talking to staff and asking questions and connecting with staff and leadership would probably be another space I would imagine being pretty effective.
Yeah.
This is Sarah, and I'll just quickly jump in too. So I will say that in the back of our 101 report, at the end of it, we provide a series of steps that people can explore to help with this. But I think partly it also depends on your goals. I absolutely agree with everything that everyone said so far. I think if you're just interested in starting, sort of getting your feet wet at all, that there often are opportunities that MPOs are extending that are public engagement opportunities. And so just starting to sort of pick those up, like attend a workshop that they might be holding or attend a committee meeting, as people are saying, is a great idea. If you really have a clear vision of your goal, I think then you're going to want to engage in a more methodical process where you first learn about, how is the MPO structured? What are some of the power dynamics? What's publicly available information? What can you find out from conversations? And then do some of what everyone said, like looking into joining a committee or building relationships with people on the committees, building relationships with staff, and so on.
Great. Thank you, everyone. We only have a minute left, and we have a number of great questions that didn't get answered. So if you have a question, please feel free to reach out to our panelists, or if you're not sure, if it's a more general question, feel free to email Sarah or myself, and we'll be happy to get it in the right direction. We also have another webinar, a second webinar in the series, Transportation Innovations in Health. This is happening next Thursday at 10 a.m. Pacific, 1 p.m. Eastern, and you can register online. We'll be hearing from 3 additional MPOs about what they're doing to support health and equity through additional studies, task forces, and programs that serve their communities. And Molly just popped the link into the chat box so you can go ahead and register. And then last, we still have time to register for the Safe Routes to School National Conference happening in November in sunny Tampa. We hope to see you there. And before we leave, I want to let you know that we do offer, the Safe Routes Partnership offers consulting services. So if you're looking for customized trainings or workshops or assistance in planning or policy, please email me at michelle@saferoutespartnership.org or visit our webpage. And finally, we'll be sending out a very quick survey to follow up on the webinar and would love to hear your feedback. It helps us develop our future webinar series. And finally, thanks again for attending the webinar, and thank you so much to our speakers, and we hope to see you next time.